felt like there was this sort of rope around my chest, like a big knot, and it was just like pulling me way down.
And it was just like so many things all happening at once. And we just knew we couldn't do this all on our own. And, ain't too proud to beg kind of thing, right? Let's look for support and get it and just get ourselves through this, was probably the toughest period of our collective lives.
Mm-hmm.
This condition of postpartum depression can happen to anyone. Doesn't matter what walk of life you're in, what income level you're at, what cultural group you're from, it can happen right across the board.
Like everybody says, you just need to will away your depression. It's a mind over matter kind of a thing. And I felt that to a degree, certainly in the beginning. And I remember going in to see my family doctor for that first initial visit, and he said to me, "You need to start medication immediately." And I hummed and hawed, and I didn't want to. And he just looked me squarely in the face, and he said, "Postpartum depression can get very serious very quickly. You have to do this."
The public health program is a good resource to start with. The family doctor would be another good resource, and the emergency department probably would be another one if things are very serious and they're concerned.
Many women came in, they felt the same way that I did coming into the group, that they felt very defeated by, that they actually got postpartum depression. Like it's something that you've got a choice in. You don't have a choice.
I went to a group that was for women experiencing postpartum mood disorder. And that group of women was amazing. I looked forward every week to going to that group. It was hard. It was so hard to go there and recognize that we were all sick and we all were experiencing motherhood in a different way than other people experienced motherhood. But we all gave each other strength and encouragement. We all recognized that it wasn't our fault and that we would get better. We just needed some time, we needed some help.
I went to that, to the postpartum adjustment group, and that was around the same time that I was also starting one-on-one therapy at Toronto East General Hospital.
There was one-on-one counseling with a family therapist. Again, that was another piece to really give me, for me, that therapy was all about coping mechanisms for my regular everyday life and helping keep my anxiety in check.
To be able to learn some, tricks to, stop the negative thoughts and, pause my thoughts and think about what I'm thinking and realize that, maybe that's not the way that was intended, or maybe that's not reality.
Medications also played a big role as well. Getting on the right med, getting on the right dose can take a little while, but it's worth it. Recognizing that sleep was a huge, huge concern and led to more difficulties rather than less. So my husband did help with making sure that I had enough sleep.
Being able to be completely honest on a regular basis with a counselor and with this other group of moms was when things also really started to change. Just to be in a non-judgmental environment and hearing other people's stories was incredibly relieving.
I could see the difference after when I'd come home from work and she'd been to one of the sessions and talking to other people. I could definitely see that there was a change there.
It took quite a bit of time, actually, even though the therapy was one-on-one, but I did feel immediately better.
Mothers usually respond to treatment, whether it be psychotherapy, support, medication, and following them along fairly closely until things resolve. And, I would say the majority of the time mothers will get better.
It was kind of 2 steps forward, 1 step back sometimes. And it was very difficult with that 1 step back because I would see myself seeing the light, and then all of a sudden I'd be back into the darkness.
Feeling like I was out of the woods because I could shake things off. I didn't internalize them as much was when I realized that I was getting out of the postpartum phase.
Where I did see that I was getting better was when I had enough sleep and, you know, the medications were working. I was actually able to tolerate going into the grocery store and not having it totally overwhelm me.
Having the good supports in there, having ongoing psychotherapy support would be helpful. And I think the partner and the family members being aware that this can be a recurring condition.
I really think that the advice that I got from the support group in Ottawa was, you know, this is treatable and you will feel better. That was the best thing I heard.